We're so excited to be able to launch the Latine and Indigenous Power Hubs Network. This is a project of LCHC, and there's 16 organizational partners across the state, from San Diego all the way to the Bay Area, that are informing what will be next for Latine and Indigenous health equity.
In order for us to fight back against systemic injustice, we need to work hand in hand to advance policy and systemic change. And today, we brought together leaders from across California to do just that, to work hand in hand to advance a formal health equity agenda that looks to bring up justice for our Latine and Indigenous community.
I think the current political climate is very divisive, right? And I think that is the intention. I think the intention is just to not only threaten us, but really scare us, right? I think if we are not working in a coordinated, unified way, we're going to be more vulnerable, right, to those attacks. Now more than ever, we have to be unified, we have to be working together. There's so much power in numbers, and I think that as community organizations and trusted messengers, we really have an opportunity here to come together as a unified force.
We're the experts of what's happening in our communities, and that's a very important key thing that we have. Creating those spaces and opportunities that we can all ask questions, we can learn from each other, we can connect, we can hear about different strategies and perspectives. Those are all parts that are going to help us to grow together and to continue this fight and bring other people on board as well. The more people that we can bring into the movement, the more people that can be aware that this is also impacting them. It's not just us versus them or only in this specific region. We're all very interconnected, and a lot of the things that happen to our health in our communities, everything trickles back down to everybody else.
In the short term, I hope we're able to get folks the resources they need in order to be able to stay up to date and informed with some of the latest policy decisions happening both at the federal and at the state level. In the long term, we hope to build the infrastructure that's needed to make sure that all of our communities are thriving.
Latino Health Access es parte del Regional Hub porque unidos somos más fuertes, porque nos damos apoyo y porque creemos en lo mismo. Yo creo que los Regional Hubs a largo plazo tenemos que plantearnos cambios que de verdad sean profundos, que tengan que ver con modificaciones de los sistemas, de las estructuras, que hacen que permanezcamos sin servicios, que permanezcamos marginalizados y que allí tiene que ser el foco. ¿Cuáles son las políticas y las actividades que hay que hacer para transformar estos sistemas de manera que respondan a las necesidades y aspiraciones de nuestra comunidad?
Some of the short-term goals is to have a health equity network that is regional, that is diverse, that is inclusive, and drafting and co-leading statewide health equity agenda that takes into consideration every single aspect of the social determinants of health. There's so many ideas that could come into policy action, and we know that policy is a way to make things happen for our communities. So we have to think about, every single aspect that influences our ability to thrive in society, and it starts with health.
It's always good to be among people who are doing good work. Very inspiring to learn from others, especially amongst all the leaders that were here present today. We're fighting the good fight in different avenues and intersections, so I think it was a great learning opportunity, an opportunity to build alliances, learn from each other, to be able to share resources, and to figure out ways to collaborate to be able to make a greater impact in the communities that we serve.
I think one thing that we can always rely upon is people power. I think ultimately that's what transforms community, and it's important to stay rooted in that.
Health equity and public health is like a puzzle, and all of us play a very unique puzzle piece that completes the bigger picture. So only when we work hand in hand and support each other are we able to complete that full picture of justice. We're bringing our own table and our own chairs, and we're saying this is how we need to advance the work. We have the community wisdom, we have the experience and the expertise to drive systemic and policy change, and we are here to do it.